Welcome to Connections and Conversations, an advocacy arena podcast, working to increase civic engagement and strengthen our communities. Hello, guys. I am so happy to be here today with a wonderful guest, Dr. Katrina Green. I am excited about our conversation because she's someone who came on my radar, not because she was a doctor, but because of her advocacy, and it just touched my heart. I've gotten to know a little bit more about her, and I am happy to introduce her to the advocacy arena community and want you to get to know more about this amazing woman. So I want to get started with allowing Dr. Green to say hello and tell us a little bit about what she is currently doing. I know that she is an ER doctor here. She is also on the board of the American Medical Women's Association and very involved in advocacy and the Tennessee Legislature. So, Dr. Green, if you just want to just greet our advocacy arena audience, and I have some questions that I'd kind of like to get to after that.
Sure, yeah. Thank you so much for having me. It's great to be here. It's a beautiful day, nice and cool, not too hot. I love talking about advocacy. It's my passion. It's the way I feel I can best impact my community and keep my community safe and healthy.
Your passion always comes through when you speak. And I was really, really impressed when we had you as a guest, which you so graciously agreed to. I serve on the board of Blue Tennessee, also an advocacy group trying to get more Democratic candidates into our legislature here. And I was impressed with your answer to the question around what inspired you. I definitely want to get to that. But first, I'd like to talk about you in your profession, because over this past decade, we have experienced some really tremendous events, and they have certainly impacted your profession, one of which being COVID. Can you tell us a little bit about what that was like navigating that period in our world and in your career?
Sure. Happy to. So I'm an emergency physician. I came out of residency in 2011. And if you had told me that, less than 10 years out of residency, I would be living through a global pandemic of epic proportions, I would have been like, no, that sounds like sci-fi. That sounds like the movie Outbreak. There was no way that's going to happen.
Exactly.
But lo and behold, it started coming on my radar, I think, at the end of 2019 when we started hearing those reports of this mysterious virus in China. And I was like, well, SARS never really came here. I don't need to worry about that. And boy, was that thinking wrong. We kind of watched it march across the globe, and I was very concerned when I was starting to hear reports of healthcare workers dying. The doctors in China, the doctors in Italy. And I was getting terrified as it got closer and closer. It was in New York, it was in Seattle.
Sure.
And then, oh gosh, there's a case in Tennessee, right? I think it was in Williamson County was the first case we had reported, at least here in Middle Tennessee. And that's when I was like...
Sumner County was hit very hard too, and that's my hometown.
Mm-hmm.
I remember the nursing home there, which my mom had been she has passed away, but she had been a patient there in rehab, and the hospital, because my mom was an RN and she did work in the ER and also like post-op work. So it really made me think, because she had just recently passed, and I'm thinking, thank God I didn't have to go through this experience during this period with her.
Yeah.
Yeah.
There was just so much uncertainty, and, my hospital was on high alert at that time when we had that first case in the area, and we knew it was just a matter of time before we'd see it at our hospital. So we had this protocol of, everyone gets their temperature taken, you have to screen, have they been out of the country? And that's where I think we missed a lot of cases early on, was just assuming that you could only have the virus if you've been to China. But lo and behold, I had a patient that fit the criteria, had a fever, tested positive for the virus, and I was the first doctor at my hospital that had a patient test positive. So Then occupational health is contacting me, sending me a form. I'm taking my temperature several times a day, keeping track of if I have any kind of symptoms. And it's like 2 weeks after that patient, you have to keep this log. Well, by the time I was done with that log for that first exposure, I already had another one. And so it quickly became useless for us to even need to fill out this form because we were getting exposed almost daily in our ER. And that's when the PPE, personal protective equipment, the masks and the hoods and the gloves and the gowns, like everything we were wearing, because we didn't know if this was droplet or airborne. Things were just coming at us so fast. And the equipment was becoming scarce because the supply chain, right? Most of these things are made in China and we weren't able to get them quickly. So our hospital was scrambling, our whole healthcare system
Right.
was scrambling to find enough equipment. That's when I sent out an SOS to my friends in the community and I said, hey, does anyone have any of those, like the big masks that you wear for like painting and the filters? And my friends and their friends, like supplies just got dumped on my porch. It was so great to see, as terrified as we all were, the community really came together to help support healthcare workers at that time. And that was when I felt I was in the right place at the right time. This was what I trained for. I'm doing my job as terrified as I am. I don't want to bring this virus home and hurt my husband, or, we isolated ourselves from our friends and family. That was really hard. But I felt like I was really helping people. It was sad that it's not that way anymore in healthcare.
I know. For one brief shining moment, even in the middle of all that horror, I felt like the world could recognize the significant role that healthcare workers play in our life, in our community. And that really warmed my heart, as scary as all of it was, because as I said, my mom was a nurse. I'm a veteran and in the military. I was in a combat support hospital after. I've done a few things, but I've also worked for orthopedic surgeons. So it just really touched my heart that people could see the importance of our healthcare workers, and we're giving them a lot of honor. Like I remember the kind of nightly parades and tributes in New York and places like that. But we did get through it, and then we moved on to other things. And one of the next things I know here for us in Tennessee, I feel like probably impacts your profession, and it probably was before COVID too. But we had a school shooting here. And that is, I think, when I really start to see you and read a lot about you. Tell me about that experience for you and gun violence in general, because I know this is one of the areas that you advocate around.
Yes, it is. Probably the first thing that pulled me into advocacy outside of the hospital was gun violence. I worked at a hospital that was becoming a level 2 trauma center at the time, hadn't yet turned into one, but it was going through the process while we were seeing a big spike in gun violence here in Nashville, especially among the youth. And where that hospital was centered was very close to a clustered neighborhood where a lot of that was happening. So I was seeing a lot of, I won't say kids, but to me, like people in their late teens and 20s are still in adolescence. So to me, they are kids, and they were coming in critically injured and sometimes just dead. And we couldn't do anything to save a lot of them. And that just broke my heart. Every time I had to tell a mother or a loved one that your loved one is gone, it just felt like, what are we doing? This is a life that's cut way too short. You shouldn't have to bury your child in their teens and 20s. That got me thinking. I did a lot of soul searching. I did some research and some outreach to folks, like how do you prevent people from getting shot? And I stumbled upon the concept of gun violence prevention and violence interruption, and met Rashida Fatuga, who runs an organization here in Nashville called Gideon's Army that does that kind of work. And so I reached out to her, got to know her. I'm still involved with that organization on the board and help her. But, at the time that happened, it was after the Waffle House mass shooting where I got really involved in gun violence. So that kind of wasn't on my radar at the time, although, you hear about these shootings almost every day in the news, just all around.
Speaking of the Waffle House shooting, that was something like I knew gun violence was a problem, but talking about hitting close to home,
Mm-hmm.
actually, one of the victims was the niece of one of my neighbors and best friend. We belonged to the same church. We had actually come home from church. I rode to church with her that day, and she dropped me off when we found out about it.
Ugh, it's just these events are horrible. They touch so many lives, not just the immediate people, injured people in the vicinity, but their family members, their friends, their loved ones. It expands out in a big ripple effect. So that leads me into the Covenant shooting at the Covenant School. Now, I don't know anyone personally, or at least I didn't at the time, that attended that school. It is on the other side of town from where I live. But I was getting ready to head into work that day, and I got a text from one of my coworkers who was at work. I was going in to relieve her, and she said, just a heads up, there's a mass shooting happening. There's a high alert been sent out to all of his hospitals. And the hospital where I was working then, which I still work at now, is not a trauma center, but should the trauma centers get overloaded, then ambulance traffic for other things gets diverted. The walking, or wounded, things like that might get sent to these other hospitals. So we're like, oh gosh, and so I immediately look at my phone, look at the news. My heart just sank when I saw that it was at a school with young kids. And so I drove into work just not knowing what's going to happen. What am I going to see? I get there. My coworker, she's completely lost it. She is in tears. She's got young children. She's like, oh my gosh, I know people from this school. Apparently one of the children who was killed was the child of a doctor at Vanderbilt. So, this is something that really touched the medical community in a very profound way. And the trauma surgeons that stood ready at Vanderbilt Children's Hospital that day, they had cleared their ER, they had cleared the ORs, they were ready. None of those children even survived to the hospital. They were all DOA, dead on arrival. And so, that just devastates us when there's literally nothing we can do. We went to medical school to help people, to heal people, to fix broken things. And when something is so broken that we can't even fix it, my heart goes out to all those doctors that were involved and ready. And you can hear it in my voice, like, this is an emotional topic.
Yes, I can imagine because I had wanted to go into the healthcare field right after high school, following in my mom's footsteps. I thought I'd start out like at a nursing home, but I couldn't handle it because I got so attached to the patients. And mom's, she said, it's not for everyone.
Yeah. Well, I made a decision a long time ago that if I became so numb to the pain that I was witnessing, when I can't become emotional about these things that are tragedies, right? Then it's my time to leave the profession. If you're so jaded and so numb that little children filled with bullet holes doesn't get you upset and close to tears, maybe it's time to retire from medicine.
I'd agree with that.
Maybe you don't belong there, but that's just me. There are a lot of doctors who came through, before me who are trained to suppress all that, hold that in. You don't cry in front of your patients, right? You have to be very stoic and solid. But I came up after all of that. And now it's okay to sit with your patients. And I think folks appreciate it more when they see the human side of their doctors.
Yes.
When I can sit with a patient who's actively dying in my ER and hold their hand and cry with their families afterwards. That's meaningful.
It really is. I appreciate that. And so now I want to go into your experience that we're still living under post Roe. What was that like for you as a doctor and the profession? Because I know that it impacted, medical professions across the nation. But Tennessee, of course, is one of those states that had extreme abortion ban laws and not being really as connected with the medical profession. Now, I imagine that a lot of doctors left or are leaving or deciding not to come here, even though the healthcare industry is a big industry here in our state. Tell me what you felt once that decision was made and maybe how some of your coworkers and others felt.
Thank you. I was in the crowd that was kind of in the know with the Dobbs decision coming up. I had been a donor and very active in the Planned Parenthood community for a while. And so, I got their regular emails and I had my ear to the ground. I already knew that Tennessee had passed a trigger ban. So should Roe ever be overturned, we were going to have an abortion ban here go into effect very shortly afterwards. Unfortunately, I wasn't paying attention so much back when that happened, but you live and you learn. And so I knew when the Dobbs decision got leaked that it was just a ticking time bomb. It was like the countdown clock had begun on reproductive rights here in Tennessee. And so a group of doctors and we just, we kind of found each other organically, talking with so-and-so and so-and-so. And I know this other doctor and they're worried. And we put together a group chat of doctors who were going to respond in real time when it happened. We were already planning on a press conference for the day the Dobbs decision happened and another one when our abortion ban went into effect. We gathered together the doctors that were most likely to be affected by this immediately, right? I mean, it affects all realms of healthcare, right? But OB physicians, of course, family medicine practitioners, emergency physicians, because that's where someone goes when they have a pregnancy emergency, it's the hospital, right? And then patients. And so we all gathered together and spoke at the courthouse steps, and we called it Healthcare in Handcuffs was the name of our press conference. And we strategically held it in front of the courthouse where any of us would be taken if we got arrested for providing care to our patients that was now illegal. The Tennessee abortion ban, when it went into effect, and I don't remember the dates.
Yeah, because they tried to move it up, actually. Even though they already had the law, they were so eager, they tried to rush the trigger law that was already in place.
Yeah, the way the law was written, it had to go into effect a month after the certification of the court ruling. So even though the court announced their ruling, it wasn't certified until X amount of days after they ruled. And then our abortion ban didn't go into effect until 30 days after the certification. So there were some steps, and our AG tried to do some gamesmanship. But yeah, we spoke on those courthouse steps, and our abortion ban was so strict that ectopic pregnancies were not excluded. Someone who's having an incomplete miscarriage, who it's before viability, but there's still a heartbeat, but it's inevitable, they're hemorrhaging. None of those things was excluded. Rape victims, children who'd been victims of incest, women who have fetal anomalies, so where you've had an ultrasound that shows that there's something so incredibly wrong with this fetus that it's not going to live outside the womb. None of those things were exceptions to our abortion ban. And a bunch of us doctors, we were terrified that if we saw some of these patients and just wanted to help them do the evidence-based, best practices, compassionate care that women in Tennessee were used to getting, that we might get arrested and go to jail. It wasn't just the fear of getting arrested and going to jail, right? That's just taking away our freedom. But once you're under arrest, because this is a felony charge, right? A Class C felony with, I think, up to 15 years in prison, if I don't remember incorrectly. While you're even just under arrest, when you've been indicted for this, you're going to have your medical license suspended. Your hospital privileges will be taken away. Most of us have a big chunk of student loans still to pay off, and then you're no longer able to work your job, so you don't have an income. Some physicians, even the women physicians, are the sole breadwinners of their family or the majority earners of their family. Then you're like, oh gosh, I can't provide for my family just because I've been arrested. Because someone said I performed abortion care that's now illegal.
Because you were doing your job.
Right. And an ectopic pregnancy, for listeners who aren't aware, that is a pregnancy. It's also known as a tubal pregnancy. It's where pregnancy implants outside the uterus. So whether it's in a C-section scar, the tubes, the ovary, there's been case reports of a fetus or embryo implanting in a liver. Those things are going to kill the person who's carrying that because it's outside where it's supposed to be growing. And it will never turn into a baby because it's not in the uterus where it's supposed to grow. But the longer we let that embryo grow, the more likely the woman is to die. And so after the trigger ban got instituted, I had several days where I was driving into the hospital going, is this the day where I see a patient with an ectopic pregnancy And I treat her because that's what I'm supposed to do. I took an oath to do no harm. I'm not going to let someone die on my watch. Is that the day that my oath to not harm my patients gets me arrested and possibly put in jail for 15 years?
Yeah. And you spent so much of your life training to do this job. That's what a lot of people don't understand about your profession. Most people in healthcare spend a lot of time training to do that job.
Yep. So a lot of our advocacy that sprung out of those initial press conferences was, sending petitions to the state legislature that eventually turned into taking out a full page ad in the Tennessean that ran for, I believe, a week or two, just asking the legislators to please rethink this, and that we had that signed by over 1,000 doctors here in Tennessee. And then just going up to the state legislature and educating them about, like, if y'all don't know what an ectopic pregnancy is, maybe you shouldn't be making laws about women's bodies.
You think?
Right? But not saying it in those terms, trying to be friendly and open. And Dr. Amy Gordon Bono is one of my fellow physician advocates here in Nashville. And this woman is a pro at really schmoozing these folks and coming across is very caring and genuine. And I mean, she does the Southern charm, and I just sucker punch them with y'all are going to put me in jail. Stop it. Right. But it's been very great to see this community of doctors just grow and expand. Now we have oncologists, we have cardiologists, we have pediatricians, because pediatricians, they diagnose pregnancies sometimes, and that's horrible.
Yes.
When you have a 12, 13-year-old, that's under the age of consent. And I mean, we could go into why is the age of consent 13 in Tennessee? That's way too young. But if you're 13 and under and you're pregnant, you have been raped legally in all the definitions. And so, pediatricians seeing a patient like that, they're going to tell the family, you can't get your child any help here. You're going to have to go to another state now to get care for your child, unless you want your child to then become a parent.
And you have to be careful about that, because not only did they pass laws around the abortion, they passed laws around helping people to go other places.
Yes. I call it the doctor gag rule. If you're not going to let me counsel my patients about where they can get the care that you say is illegal here, you're not letting me counsel my patients. They tried to pass a bill that wouldn't let me ask my patients about gun ownership. And that's something that we have to do in the ER to determine how serious your suicidality is. If you say you want to kill yourself and you say you want to shoot yourself with a gun and you have a gun, that is the most critical mental health crisis that I see. But if I can't even ask that question, I don't know how likely you are to kill yourself with a gun. Pediatricians counsel their patients about safe storage, so that we little hands don't find these guns that are just, stuck under a mattress or in a drawer beside the bed, because that happens every day across Tennessee. A little child finds a gun that they're not supposed to, shoots themselves or someone else.
Yeah. I grew up in a family in a time when literally, as a kid, I rode around in trucks with my father and grandfather with the gun rack in the back. My dad had his gun rack in the living room. It was a different time. And there were instances even then where there were kids who had accidentally been playing around with their parents' guns and got shot. But of course, it has gotten worse today. And here in Tennessee, in particular, because of their lax gun laws, they have literally attracted more gun manufacturers here, one to my hometown. In fact, they passed one of the permitless carry at the gun plant in my hometown. It's so disgusting. Not that we shouldn't have them, but after the Covenant shooting, they didn't want to take time during the legislature to address any type of common sense gun laws. But they did take time to provide immunity to gun manufacturers. It's just so disgusting.
Yeah, it's so backwards. And where in the Second Amendment is there any wording that we can't make sure people are going through a safe process to be a gun owner? I'm not a gun owner personally, but I have several family members that are gun owners, that are hunters and whatnot. And I don't want to take guns away from anybody that's not dangerous, right? I want everyone to go through a background check and make sure you're not a dangerous person.
Yeah, my father is an outdoorsman. He has all kinds. And like I said, it's about responsible use.
Yes. And that's where the responsibility piece has been taken out of the process here in Tennessee. When you have permitless gun ownership, you have a gun owner who maybe has never fired one before that just, was like, I'm going to go get one for personal protection. Doesn't know how to use it, doesn't know how to safely store it, has never been to a gun range or even shot a gun. And I'm not saying that's everybody, but there are gun owners like that out there that don't understand that with great power comes great responsibility, right? Just be a responsible gun owner. Learn how to use your firearm. Learn how to make sure it's unloaded when you store it, especially when you have little children in the home. Teach your children about gun safety and gun responsibility, right? Don't just go buy a gun and just expect your children not to find it. They know where the Christmas presents are. They're going to find a gun. They're going to find the Christmas presents.
They are the best treasure hunters.
So just be responsible. And that's something where, when they're trying to pass these laws that don't let me and my colleagues at least have that conversation. As much as everything has changed since COVID, physicians and nurses are still some of the most trusted professions there are out there. And so we are a trusted messenger. When I counsel my patients on, don't smoke, they're a lot more likely to quit smoking. When pediatricians counsel the parents of their patients to safely store their guns, they're a lot more likely to think about, like, how do I store my firearm, and will my kids find it? And maybe I should go and get one of those free gun locks that the state has. But if we can't ask the questions, I don't know what our state legislature is thinking. But they just keep passing these laws that make it harder for me, my colleagues, to do our jobs. And so that's why I go up to the state legislature and I advocate and I try to have these discussions with them about, what they're doing and how it's harder for me and my colleagues and my patients.
And I appreciate that. In fact, I think when we had you in our Blue Tennessee meeting, you talked about kind of arranging your schedule during the legislative session so that you could actively be present there. What made you do that? What drives you to do that?
They tend to have their healthcare related committees on Tuesdays. So I pay a lot more attention to the healthcare related bills than anything else. Although there's something called the social determinants of health. So having a safe neighborhood, having, clean water and air, and there's so many different factors that go into healthcare that we don't typically think about. Education being one of them. And so
something else that's under assault.
Yeah, went up to the Capitol a lot this year with regard to that education bill they were trying to pass. But yeah, just making sure that I was at least off on Tuesdays and paying attention to the schedule when they would release the committee schedules to see, like, is there something on the docket that I need to be up there for? And being a part of like several different group chats where we could send out an alert like, oh my gosh, like I just saw this bill is being voted on today. Can you get down to the Capitol? And like, oh, I didn't want to go today, but okay, throwing on my white coat and driving down the Capitol again. I've learned strategically where to park, where I don't have to pay, but I got to walk up all those stairs to get to the Capitol.
And what's it like now? Because after there was such an outpouring of protests and activists after the Covenant shooting, they changed a lot when they had that special session. They changed so many laws about the access that people had to the Capitol and to those legislative sessions. What's that like now?
Right. Well, I mean, you still have to go through security just like normal, either in the Cordell Hall or at the Capitol building. You still have to go through the metal detector and all of that stuff. So that hasn't changed. What they tried to change, I think it was during the special session. There's been so many sessions in the past 2 years, I'm losing track.
I feel
but one of the sessions, Cameron Sexton passed a rule that you couldn't even bring a sign into the committee rooms. And that's where two of the women, maybe even three of the women, I think they were mostly involved with the Rise and Shine organization, Rise and Shine Tennessee, took their signs anyways. And they were like, you're going to have to carry me out of this room because it is my right. This is my First Amendment rights. And Allison Polidor, I believe, was the mom who was the first one to get kicked out of committee when that happened. And God love that woman for being so brave. I was in that committee too and, watched it happen. And I was just like, I can't be arrested. I can't be thrown out of here. I can't be carried out in handcuffs because I still need to do my job. And
The community needs you. Yeah.
yeah, but these women who are brave enough and have the wherewithal, the privilege to do that, God love them. They are my heroes.
Absolutely.
Literal hero, the little grandmas that have gotten carried out of this committee because they're like, what y'all doing are, it's wrong. You can't make me leave. You're going to have to make me leave. So that was like the banning of the signs.
Yeah.
But I think the ACLU was involved in the lawsuit right as it happened. And they quickly, a judge overruled that and was like First Amendment rights. So we were still allowed to bring our signs in. But there was a couple of days where you can bring a sign. The golden ticket to get into the gallery. So in the committee rooms, it's first come, first serve. Although sometimes they have a strategic way of getting all their interns to fill a room when they don't want us in there. Or the lobbyists will all show up one day and you're like, there's no room in here. In the gallery for like the House floor sessions up at the Capitol, they instituted a policy last year where you had to get a golden ticket.
Yes.
And they only issued 99 of these tickets, supposedly, one ticket per legislator. And so you had to contact your legislator to get one of these tickets. And as we know, Tennessee has a Republican supermajority. So guess who doesn't have a whole lot of tickets to the gallery? Anyone who's progressive and Democrat, because there are only 25. So I showed up several times and was not able to get a golden ticket. And so just had to stand around in the rotunda, watch what was happening on the little TV. But pro tip, if you ever go up to the Capitol during House floor session or Senate floor session and you can't get a seat because it's either full or they've done some of these like seating chart shenanigans, they can hear you when you protest in the rotunda. In the House floor session and the Senate floor sessions, they can hear us when we say, our house, this is our house, or whatever we're chanting, they can hear us from the House floor. And so that means that it's actually getting picked up on the microphones for folks watching on the live stream at home. And so it really makes you feel like my voice is definitely being heard right now.
I love it because that really bothered me that they would go to like trying to prevent people from, having signs and trying to prevent people from being there. Like I know one of the local reporting networks that we have, Tennessee Holler, can't even go in there anymore. He doesn't have access as media, and he was doing a really great job. And that is, for me, a very dangerous sign when, they try to stop basically us assembling and our First Amendment right. So I could see, you could too, anyone living here in Tennessee, some of this authoritarian kind of behavior taking shape here because they have control. And now we see these things being tried from a federal level. It's very concerning. And I know that you are not going to stop fighting. I would like to ask, what's next for you? What do you envision your activism and your advocacy focusing on, the direction?
Right. I think for me, it's been a whole evolution of everything, right? I started off as a gun safety advocate, and then COVID, and then reproductive rights, and now just fighting for just basic things like educating all children in Tennessee, right? I've seen how community advocacy only goes so far, and you need to pass better laws. And then you go up to the legislature and you try to convince them to pass better laws, but they're not doing it. So I've evolved my whole thinking into, now it's time to get political with advocacy and activism.
Yes.
Because we got to flip some seats.
Mm-hmm.
We got to flip some seats. We cannot live under a supermajority anymore because they have proven that they feel that they are above us. They are unaccountable to what the majority of Tennesseans want. Like poll after poll comes out showing that the majority of Tennesseans support gun safety laws. At the very least, safe storage and red flag laws. People want those. People support exceptions for the abortion ban for rape and incest. Overwhelmingly, we don't want little children to get pregnant because, their pastor, their uncle raped them. And if that happens, we want them to be able to get the care they need. Anyone who's been raped needs to have the ability to reclaim control over their body and say whether or not they want to continue to remain pregnant with their rapist child. And so the majority of Tennesseans want those things, but our state legislature is not listening to that. Even their own constituents, they're not listening to the majority of the time. So I am am going to do everything I can in my power to help get good people elected this next cycle. I was very heavily involved in getting Shondell Brooks, Representative Brooks, elected the last time around. I served as her treasurer.
Mm-hmm.
I knocked on countless doors for her, helped organize her phone banks, got a couple of endorsements, and I had a lot of fun doing that. And so I caught the bug. I'm trying to convince a friend of mine to run for office up in Sumner County. If I can't convince her to run, then I'll probably join Dr. Laura Andreessen's campaign, because she has said she's going to run again next year. I think that's in District 63 against Jake McCalman. Let's just keep pushing the needle. Every time a progressive runs in a race, they move the needle a little bit forward. Eventually we're going to tip it over to the point where we get someone good elected in some of these seats.
At the very least, they need an opponent, and Democrats need an option to vote for. I'll get with you on the name of this person you're trying to push, because Sumner County, I still pay attention to it because that's where I grew up. And we need good, strong candidates, because they've certainly taken over there on the local level, doing the same thing that they're doing statewide here now.
Yeah, we need good people to run, and we need them to run all over. I think we had the fewest number of uncontested races in Tennessee that we'd had in a long time last year, but I think we still had 18-19% of races were uncontested, and that's just unacceptable. People aren't going to turn up to vote when there's no option on the ballot.
Exactly, and that was what drove me to get involved in Blue Tennessee. I've been an advocate, I would say, my whole life, just approaching it in different ways. Sometimes it's very political, and sometimes in other organizations it looks different. But I decided to really focus on the political aspect after post-Roe, all of the things that have culminated basically in this decade and a half since the Republicans have had control of our legislative body and the governorship. And I said, we need to get some Democrats in here. And I found Blue Tennessee, David Pepper. I encountered him in another community that I was involved with. And I saw what they were doing in Ohio, they were able to actually get the abortion into their constitution there, largely in part of because of, the efforts of Blue Ohio supporting candidates. And I wanted to bring that same energy to Tennessee. So I helped with the group that helped to found Blue Tennessee here and serve on the board. And I'm really glad that you are part of our community, and just looking for more and more candidates to support in that way, and look for other ways that we can support our communities, bring awareness and activism to things like gun violence and just our rights, because every year they do something just really awful. This year was no different. They closed with dismantling the DEI Act, which is, basically a rollback of civil rights. And this is going to affect so many people, even people I don't think they are aware of how they will be impacted by it. So I am so glad to have people like you who have found their passion around supporting candidates and picking issues, because, we can't all do everything, but we can do something. And when you lean into those things that you really are passionate about and care about, I think it matters. As you said before, I use that analogy a lot, the ripple effect. I think that we have more power than we believe sometimes. So I would like to ask you to share some words with the advocacy arena community around activism and, advocacy that you'd like to leave them with, and we'll close out. And I just want to thank you for being here for a great conversation.
Thank you. Yes, thank you for that. And I think something that you just said is so important. We all have so many things we're concerned about right now, right? There's a lot going on in the world. It can be easy to get overwhelmed. What I did when I got started with my advocacy is I picked that one issue. For me, it was gun violence. This is one thing that I care deeply about. Let me figure out how I can help. Who in the community is doing that work? If you look around and you do the research and you don't see anyone who's doing the work, maybe that's your sign that you are the person, you are the change you are looking for. Go for it. Reach out to other members in your community. Talk to people about these issues. It's time to stop pussyfooting around politics, right? Like it used to be, you don't talk about politics at the Thanksgiving table or family reunions, whatever. now is the time where you got to talk about it. You got to have some frank conversations.
It affects every aspect of our lives.
But when you have these conversations, it's important to come at this with a curious mind. I love the quote from one of my favorite shows ever, Ted Lasso, be curious, not judgmental.
Oh.
When you're having a conversation with someone who's on the opposite side of the spectrum of you beliefs or the other side of an issue, it's time to ask questions. Why do you feel that way? Why are you anti-abortion? Why do you feel that it's okay for women who've been raped to have children? Like, why? Tell me why. I want to know why, what your thinking process is. And the more you ask someone why, the more you get to the bottom of the issue and you find common ground with folks. I have family members that are very far right on a number of things, and we can at least agree, yeah, people should probably have to go through some kind of permit process and training to have a gun. Like, we can agree on some things, and finding that common ground and spreading out from there. So that's what I would encourage y'all to do is find those common ground issues and try to use that as a base to expand your reach. Have those difficult conversations. Do not be afraid to have difficult conversations. And then lastly, make sure you know who your representatives are. Okay, capital.tion.gov is where you can go in Tennessee and find out who your state representative, your state senator, your congressperson, and I think even your city council you can find through that too. And knowing who to contact when you're having an issue. If you're upset about an issue, please, please, please contact the people in power to do something. If they only hear the voices that they agree with, they're going to think everybody agrees with them. So they need to hear opposing voices and know that not all of their constituents feel that it's okay to take education away from immigrant kids and things like that.
Absolutely. And education, that's kind of like my passion. First of all, just community awareness, and democracy, which I feel like, encompasses our civil rights, our human rights, and education, because that helps to reinforce the other things. So I am glad that you were here today to help educate the Advocacy Arena community and inspire them. You are a terrific role model of activism and advocacy. I can't wait to see the other things that you do, and I definitely want to hear about any candidates that you are looking at, supporting and helping, and see what we can do to help you help them as well. So we are definitely stronger together. And I want to thank you for coming and sharing your time, your knowledge, your inspiration with us here in Advocacy Arena today.
Thank you so much for having me.
Thank you for listening to Connections and Conversations. This is one of many wonderful interviews that we bring to you to help connect you to a larger community of advocates and change makers across the country. You'll get a glimpse into the various ways people are making an impact in their communities. My hope is that it will inspire you to get engaged in some small way as well. We can't all do everything, but at this moment in history, we can all do something. What are you doing? One of the things you can do is to continue to listen, subscribe, and share this Advocacy Arena podcast. You can also join and support the growing Grassroots Advocacy Arena community in other ways. Join our weekly live chats hosted on Spoutable every Monday at 12 p.m. Eastern. Subscribe to our Substack to get great articles on important topics and exclusive access to extended interview conversations. And don't forget to subscribe to our YouTube channel as well. We've got some exciting programming lined up. And keep listening to our regular podcast episodes wherever you get your podcasts. And of course, subscribe and give us that all-important 5-star review.